While the cost of childcare has improved, access has not. That's according to a new survey by the Manitoba Child Care Association and Probe Research. The Childcare in Manitoba survey found wait times on average were 17 months across the province, among other findings. So the survey was more than 1,800 Manitobans. It came out yesterday. It also looked at quality of care and universal childcare. Cathy Gardiner is here live via Zoom, president of the Manitoba Child Care Association and executive director of the Learning and Growing Daycare here in Winnipeg. Good morning.
Good morning, Marcy.
So 17 months on average is the wait to secure a childcare space. What do you think when you hear that? And I should say continue to hear that because it's been a problem for a while.
Yeah, it's been a problem for a while. I'm also the executive director of a child care center here in Winnipeg. I know I have firsthand experience. I receive calls on a daily basis, emails. People find the most creative ways to contact, and it's sad. It's really sad. The survey is correct. People are spending an exorbitant amount of time on wait lists.
And how are parents, when you talk to people, like how are they managing that with work and other things they have to do in their lives?
Well, they're not. They manage it obviously the best way they can, but I think, a lot of people are depending on family and friends. And, I actually have a family here where the mom just took a leave of absence from work because she can't secure childcare for her child starting school. So, it's a sad situation.
What did you learn from this new survey? Because you last did a survey in 2016. What was in this survey that you want to highlight this morning?
Well, I think, there's good things in the surveys. There's, things that, aren't too surprising. The biggest thing I think right now is that accessibility piece and getting families the care that they need. There's a lot of, there's a lot of things that came out of this survey, but, one of the things for families is, securing childcare when they need it. And 17 months on a wait list that's crazy. I mean, no one is waiting 17 months to get into a school or start school. Children should have access to, high quality childcare when they need it. The 17 months is that's not okay. And we need to do better.
Um, what does doing better look like? I mean, is it just there's not enough providers, or there's not enough spaces where child populations are maybe booming, or what do you think is part of the key to success, or not enough maybe workers? I know we saw an increase to wages to try to get more people in the profession, but I'm wondering what has to catch up to help us here.
Well, I think there's a lot of things that have to catch up, and there's not one thing in particular that solves this problem. You're right, the workforce is one of those things. And yes, we've just recently seen a boost to wages, and we hope to see, that attract more people into the industry because you can't open up spaces without people to work in them. But if you have no spaces to open up, then that's a big part of the problem as well. So it's a multifaceted problem that requires solutions and action on all parts of those problems. We need more spaces. We need more ECEs. So it's not just one thing. It's many things.
Do you have advice for parents struggling to find a daycare space?
I really wish that I did. I what I tell people here is just, put your name on as many lists as you possibly can. Open yourself up to, perhaps maybe things that you didn't think of before. I don't have the answer, and it's very difficult talking to families each day when I don't have spaces to offer them and I don't have answers for them. It's very difficult.
Now, the survey also found the perceived quality of care is not getting better. So 92% of respondents were satisfied with childcare in 2016. Today, that number went down to 85%. So still a strong score, but lower. What changes do you think the childcare providers themselves might need to make to increase the quality of care, or the perceived quality of care?
I think that we need more trained early childhood educators. a lot of seats are opening up. There's a lot of institutions that are offering the childcare training, the 2-year childcare training, and I'm hearing that seats are filling up, and that there are people coming into this field. But I think ultimately that boils down to training, education, experience. Those kinds of things will improve quality. So we need more trained people.
In the meantime, when people are trying to navigate the systems, I mean, new parents out there might, it's all brand new, right? When you have a child and you're trying to think about this, some people start thinking about it when they're pregnant because they hear about these lists, which is it's all kind of mind-boggling. But at the end of the day, where do people access and understand, what is a licensed daycare facility, what is a private daycare facility, and how can they distinguish like what is in the system that might even be available to them to understand it?
Yeah, I believe the Manitoba government has on their website, they go into some detail about what a quality childcare center looks like, how to find those, how to access wait lists within your community or your surrounding areas. There's actually quite a bit of information, really good information online where families can go to look up that sort of thing. Also, I mean, people in the community, word of mouth, talking to, friends, neighbors, that sort of thing. You're probably going to get some hands-on or first-hand experience that way. But I think that a good starting point is online with the ELCC website.
Anything I haven't asked you about, Cathy, that you feel is important that you want to highlight today?
You know what? I think there's some good information that's come out of this survey. It certainly, shows us where we have work to do. The accessibility for families, accessing quality childcare is a very big problem. We need the government support in building centers, opening centers. Currently the government will supply 60% of the cost of opening centers, and yeah, unfortunately, the other 40% is up to the provider to come up with. That's a huge roadblock in opening up new centers. So there's lots of work to be done. The Canada-wide agreement has supported funding, for us to do some wonderful things up to this point. But clearly, we've got much more work to do.
And maybe a funding model that needs to be looked at in Manitoba. Appreciate your time, Cathy Gardiner. Thank you.
Thank you very much for having me, Marcy.